Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: do I have childhood trauma? Childhood trauma occurs when a child witnesses or experiences distressing events during their early years. Such experiences can result in a range of overwhelming emotions. These events may manifest in relationships that involve violence, exploitation, assault, neglect, or abuse. Some common behavioral symptoms include excessive or little sleep, lack of appetite, overeating, unexplained irritability and aggression, and difficulties concentrating on tasks, academic work, and conversation. Take the childhood trauma test to gain insight into your unique circumstances and better understand your situation. This concise test for adults focuses on childhood trauma and can indicate behavioral patterns associated with such experiences. However, it is essential to note that this test does not serve as a comprehensive diagnosis or precisely diagnose a particular type of childhood trauma. Childhood trauma definition. It is often described as severe adverse childhood experiences, ACEs. Children may go through a range of experiences that classify as psychological trauma, including neglect, abandonment, sexual abuse, emotional abuse, physical abuse, witnessing the abuse of a sibling or parent, or having a mentally ill parent. Child trauma occurs more than you think. Over 2/3 of children reported at least one traumatic event by age 16. Potentially traumatic events include psychological, physical, or sexual abuse, community or school violence, witnessing or experiencing domestic violence, national disasters or terrorism, commercial sexual exploitation, sudden or violent loss of a loved one, refugee or war experiences, military family-related stressors, e.g., deployment, parental loss, or injury, physical or sexual assault, neglect, serious accidents or life-threatening illness. Importance of test for childhood trauma. The significance of a childhood emotional trauma test cannot be overstated. The long-term effects of childhood trauma on emotional, mental, and physical health can significantly impact an individual's ability to form healthy relationships, thrive academically or professionally, and lead a fulfilling life. By taking a childhood trauma test, individuals can gain insight into whether they have experienced traumatic events and make informed decisions about the best course of action. Early intervention and support are crucial for individuals who have experienced childhood trauma, as they can aid in healing and recovery while reducing the risk of long-term mental health issues. Moreover, a childhood trauma test can assist medical professionals in devising tailored treatment strategies that address each patient's specific needs and circumstances. Individuals can initiate the journey toward healing and improving their overall well-being by undertaking a childhood trauma test. Physical symptoms of childhood trauma in adults. In adulthood, the emotional effects of childhood trauma can manifest in various physical signs. These signs may become apparent or worsen during stressful situations. Some of the physical manifestations associated with childhood trauma include strong reactions. Strong reactions can frequently take you by surprise. Someone you've just met could make you feel uneasy because they make you think of someone who is a part of the trauma you experienced as a youngster. One of the most prevalent indications of adult repressed trauma is this: anxiety. Adults with indications of childhood trauma are more likely to experience anxiety. Adrenaline rushes through the body in response to anxiety, telling it to fight or flee a situation. Your heart rate increases, and you can experience nausea. Childish reactions. Childlike voice trauma. Tantrums might be the result of childish responses. You have a childlike demeanor, are obstinate, and have trouble regulating your temper. Inability to cope with change. Stress results from everyday pressure to step outside your comfort zone. When a shift consistently results in strong, negative feelings that disrupt daily life or interpersonal interactions, it becomes problematic. Intense mood swings. Survivors of trauma may experience overpowering feelings or numbness. If you can't put your finger on what's making you cranky, worried, or angry, that could be an indication of trauma. Certain places make you uncomfortable. Uncomfortable sounds, images, smells, surroundings, or other sensations may be experienced. For instance, if you had a bad experience in an elevator as a child, you can have anxiety or panic in similarly cramped areas. Low self-esteem. Low self-esteem might be difficult to spot, but it usually manifests as lack of self-worth, people-pleasing, fear of criticism, or inability to set boundaries. Together with low self-esteem, frustration, social anxiety, and distrust can develop. Chronic pain or illnesses. What impact does trauma have on a child's development? According to several studies, those who experienced early trauma may be more prone to later life chronic pain or illnesses. Abandonment issues. In many cases, the very people who should be caring for a child hurt them. This can lead to an alteration in the development of trust, leading to an intense fear of abandonment. Substance abuse. People with mental health illnesses frequently seek out professional treatment or use drugs and alcohol as self-medication. Conversely, frequently, the medications they access have a high misuse potential, generating a considerable risk. People who obtain prescriptions for their disease are less likely to develop addiction disorders. Challenges with adult abandonment can result in the following behaviors that may diminish the quality of your relationships. Quickly getting attached. Lack of commitment or trying not to get attached. Staying in unhealthy relationships. Distrust. Feeling insecure. Intense suspicion or jealousy. Separation anxiety. Overthinking. Hypersensitive to criticism. Self-blame. Does everyone have childhood trauma? At least 1 in 7 children have experienced child abuse and neglect in the past year, and this is likely an underestimate. In 2019, 1,840 children died of abuse and neglect in the United States. Over 1,000 youths are treated in emergency departments daily for physical assault-related injuries. In 2019, about 1 in 5 high school students reported bullying on school property last year. 8% of high school students had been in a physical fight on school property 1 or more times during the 12 months before the survey. Daily, about 14 youths die from homicide, and more than 1,300 are treated in emergency departments for violence-related injuries. How to heal childhood trauma in adults. How does childhood trauma affect adulthood? If untreated, childhood trauma can have long-lasting effects. How to heal childhood trauma. Cognitive processing therapy, CPT, is a subtype of cognitive behavioral therapy. CAPTAIN is often the first choice when treating PTSD, especially when addressing the long-term effects of childhood traumas in adults. 3 great tips to maintain a healthy heart, emotionally, and how to improve your mental health. Find out who your true friends are. Many of us rotate between various social circles and groups of people, and everyone seems nice on the surface. But everyone who smiles at you does not necessarily have your best interests at heart. Try to really pay attention to how people you consider your friends act when you're high and when you're low. When you get a promotion or lose a job, enter a new relationship, or end one. Their initial response will be their authentic one. In order to keep a healthy heart, you want to surround yourself with people who are on your team and will be solid like roots, not wavy like leaves. Find a way to express your feelings. One of the best and most effective ways to maintain a healthy heart is to never hold your emotions inside. When you swallow your feelings, they have nowhere to go but your mind, and you can easily create a negative narrative in your head as to how loved and valued you really are. So find a way to express your emotions, be it by journaling, meditating, praying, writing poetry, writing music, talking to a friend, or talking to a therapist. If you can find an outlet for your emotions, it will be easier for you to understand and manage them. Be kinder to yourself. Our last, and personally, favorite strategy for maintaining a healthy heart is to just be kinder to yourself. You are a human, which means you will make mistakes. But your mistakes in your past do not define who you are. We are constantly evolving and growing, and that takes time and patience. Just like plants, we need water and nutrients to help us on the inside and sunlight to warm us on the outside. Learn how to rest. Do not drive yourself into the ground trying to meet deadlines. If someone offers to take care of you or bring you food because they're worried about you, let them. The We Level Up Treatment Center network delivers recovery programs that vary by each treatment facility. Call to learn more. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.